Hello, everyone. We'd like to welcome you to Congressman John Curtis's live telephone town hall event this evening. We so appreciate you taking the time to be engaged and to be informed. The fact that you've joined the call this evening demonstrates your commitment to our state and our nation. Thank you for all you do, and thanks for joining us. I'm Adrielle Herring, and I'll be your host for the telephone town hall this evening. This is Congressman Curtis's 5th telephone town hall of 2020. And we'll continue to do these calls. We hope that they're useful and informative for you. As you know, Congressman Curtis is known for his frequent town halls. And with the challenges that we're facing right now, it's more important than ever to him to stay connected with all of you and to hear from you and to answer your questions. So thanks for joining us. And now Congressman Curtis has joined us, and he's planning to share just a few thoughts with you now and introduce our guests before we take the first question. Go ahead, Congressman.
Thank you, Adrielle. A special thanks to everybody that's joined us tonight. I think you all know that I would by far prefer doing these in person with you. I miss our town hall formats. I really enjoy being with you, and for obvious reasons, we're using this. The advantage of this is that it does let us communicate with a lot more people. We have thousands of you that typically will join us on these Thursday night Tele-Town Halls. So thank you for tuning in. Just a couple of thoughts. I want, before we go any further, I want to thank my staff. I'm not sure that all of you can really even comprehend how much they're working right now, how kind of sun up to sundown, everybody's engaged and working hard, and just want to express my appreciation for them. I have a tremendous team, and that's been made even more obvious during this virus situation. Tonight, I am smart enough to know I can't answer all your questions. We've invited some very helpful guests to be with us. I'd like to introduce those right now, and throughout the night, they'll be helping me answer questions. Brian Fahey, who is on my team in Washington, D.C., and is all things legislative and quickly becoming our legislative expert in D.C., is joining us on the line. And as well as Dr. Eddie Stenyum, who is joining us. He's an infectious disease physician at Intermountain Healthcare. And Doctor, so pleased that you could join us tonight. And finally, we have Howard Headley. Howard is the president of the Utah Bankers Association. And given the nature of the legislation that was passed and its impact on small businesses, our financial institutions are carrying a very heavy load. And we've asked Howard to join us tonight to perhaps help us with some of the questions as it relates to the legislation and accessing the funds that are available. I might just mention that although Howard is with the Bankers Association, we're representing all financial institutions on this call tonight, and Howard will help us represent all of them, credit unions and the many who are really working hard. I'm stunned at the volume that they're dealing with. So thank you to our guests for being here. And with that, I'd like to jump right into the questions. Adrielle, let's start right in and see what we've got.
So our first question of the evening is going to come from Ray, who's calling from Provo. Ray, you're on the line with the Congressman. Go ahead.
Thank you very much, Congressman. Appreciate it very much that you're doing this. Quick question. My business is actually doing well. I've hired 3 people this week, and I'm going to be hiring more. But I have a lot of friends who, as you are keenly aware, are having a very difficult time in this environment. And I'm just wondering if you have any inside information as to when this might start going where we can get people back to work. That's critical in my mind. That is the biggest problem that we have right now, is getting people back to work. I think that we can handle the COVID-19 thing, but we sure need to get people back to work.
Well, Ray, thank you. And I can't tell you how pleased I am that your business is doing well. And incidentally, you might be interested. I'm calling a lot of businesses every day. I call just as many as I have time to call. And I would say roughly a third are prospering, a third are hanging on, and a third are really in trouble. And I think that jives with your call and your concern about so many who are in trouble. I'm going to first ask Dr. Eddie to address that from a medical perspective when he sees kind of the green light to return to normal, and then I'll answer it from more of a political perspective, if that makes sense. Dr. Sten-Yum, do you want to jump in on that one?
Yeah, thanks. Ray, that is a really challenging question that everybody is struggling with. And as you can imagine, I get asked a lot of coronavirus-related questions on a daily basis. And that's probably the number one question I get asked is, when do we know when we can loosen the social physical distancing measures and move back to normal? And to be completely frank and honest, is we don't really know. This is a novel virus, and it's affecting our communities in unique ways. The way it's affecting the United States is much different than China and South Korea and Italy, and we're learning a lot as we go. What we can say, and this is based on reports out of other countries and also based on historical flu epidemics, is if we release these physical and social distancing matters too early, that's going to cause significant potential loss of life and have the virus come back and cause worse epidemic. So ideally what we'd see is that we get up and over the peak of our epidemic here in Utah. And then as we're coming down the other side, we wait at least 2 incubation periods. Those incubation periods are 14 days each. And then at that point, we start slowly going back into normal life. It won't be just turn the light switch on and we're back to normal life. It really would be a graduated response, still limiting our gatherings, but being able to get back to business like we'd anticipate. So not a super clear-cut answer, I'm sorry, but it really is going to be once we hit the peak and we come down the other side, we wait 2 cycles, which would be approximately a month, and then we'd start getting back to normal life.
Yeah, thanks, Doctor. I think it's also fair to say that people are going to try to add layers to this. And what I mean by that is there's probably going to be a difference between a sporting event coming back online and a small business, depending upon how they interact with customers. And I also think it's fair to say there's probably going to be some tug and pull between the business community and the medical community. And I think to this point, we've listened very carefully to our medical community, and we may see more tugging and pulling between the business and medical community as we get closer to that time period that the doctor has referenced. Thank you, Ray, and once again, I'm glad you're prospering, and our thoughts with everybody that's not. Adriel, let's hop to the next question.
Yes, our next question is going to come from Dave, who's calling from Springville. And Dave, you're on the line with the congressman. Go ahead.
Thank you. My name is Dave Whittle. I'm the owner of Utah Private Car, and as you might imagine, our businesses have come to nothing. And I've been in the process of applying for unemployment, the CARES Act relief. I was in the middle of applying for the SBA disaster loan. And so the net of my question is, how can I know how all these programs work together? Because, I'm a pretty bright guy, but I've had a lot of trouble figuring out. I've even got an accounting degree, and I can't figure out some of the how to answer some of the questions they ask. And it seems like there's some fairly significant conflicts between, getting unemployment, getting the payroll relief under the CARES Act, getting the loan to cover your ongoing business expenses. It's just really difficult to figure out, and I'm sure if it's hard for somebody with an accounting degree to figure out, it's darn near impossible for some of my drivers. And so I'm just wondering if there's one place that somebody can go to get answers to questions that arise from trying to get the relief.
Howard, do you have a thought on that? And Brian, I'm going to ask you to weigh in as well on that. Howard?
Yeah, I'm happy to weigh in. I don't know that there's one place to go, unfortunately. It sounds like, the issue with unemployment, I've had a lot of conversations with the folks at Department of Workforce Services and the unemployment folks. It's and that has it's barriers and issues to deal with, but they're the ones with the expertise to handle that. In terms of the programs that you referenced, in terms of the EIDL loans, the SBA disaster loans, those are handled directly by SBA, and so those questions have to be posed to the SBA. Although you'll find that banks that are familiar with the SBA, most banks can give you some direction, but not a lot of, if you've applied for one and you haven't heard back, we're not going to be able to necessarily tell you where your application is or how long to expect. The SBA, because we're running the Paycheck Protection Program through the SBA, they are overwhelmed. And so that has kind of affected their ability to process the disaster loans as well. When it comes to the Paycheck Protection Program loans, that is something that you can get an answer from your bank, your credit union, wherever you are applying for that loan. But again, I have to warn you there that it's so new. There's a lot of questions that we have. Tomorrow, the program opens up to sole proprietors and independent contractors. And I'm sitting at my computer right now waiting for the guidance on that to come out tonight. And then, we'll have calls tomorrow. And if we don't have that guidance, we won't have the answers there. What kind of business do you have? How are you structured?
I'm sorry, I already cut that call.
Okay. Well, I'm sorry, but depending upon how your business is structured, there's different answers to different questions, but the bank can help you with those questions. But unfortunately, there are so many programs and so many new programs. Everybody there's a certain amount of patience, and I know it's a hard thing to talk about when people are desperate for financial help, but there's a lot of information. There's a lot of information we don't have yet.
Brian, do you have, I know there is no one-stop shop. If you had one or two places that you would refer people to for answers, where would you send them?
Absolutely. I would, just a quick point, the part of the unemployment assistance programs that are included in the CARES Act are going to be administered by states. And that funding is, I believe, the federal government already sent those funds to the individual states, and the legislatures will have to figure out how they want to administer the various programs. And I think that the Utah legislature will meet next week in a special session, and that will be the new the pandemic unemployment assistance program. They'll talk about how to dispense those funds, and I believe that the Department of Workforce Services will be in charge of overseeing it on a day-to-day basis. So I think the Department of Workforce Services would be the best resource for your employees. The website is jobs.utah.gov/COVID-19. And then on some of the loan programs, the local SBA office they launched a rapid response team, and it's basically a group of between 50 and 100 volunteers who are fielding requests from different businesses with specific questions about the different loan programs, what they qualify for, and so I would encourage anyone that's interested or does have questions about the various loan programs to submit an inquiry to the rapid response team. You'll hear back between 12 and 24 hours, depending on the demand, and they've been really responsive and great about getting back to people. So those would be the two, those would be the few resources that I would recommend.
Good. Dave, hopefully you were listening and we were able to give you a little bit of information. All right, Adriel, let's hop to the next one.
All right. Our next caller is Ron. Ron's calling from Spanish Fork. And Ron, you can go ahead. You're on the line.
Thank you. I appreciate the work that you're doing in Washington for us all. I'm very concerned, maybe this is too early to ask, but we are borrowing an unbelievable amount of money from the future. Do we have any idea how in the heck we're going to pay back this additional debt that we're getting into for this stimulus action that's going on?
Ron, you ask a very good question, one that I've spent a considerable amount of time pondering. As I voted for this bill, it weighed heavy on me. As a matter of fact, before I voted, I gave a speech on the House floor and reminded my colleagues that we were writing a check from an account that was overdrawn and that we had to address this. I think to a person, those of us that voted for it felt like the alternative simply was not acceptable and overwhelmed the fact that we were adding to the debt. But I will make my commitment that as we turn to Washington, I'll make that a priority as I work with my colleagues in trying to give you a better answer for that question. And you are right to be concerned about it, and I'll keep working on it, and I'll make you that commitment tonight. Thank you, Ron.
All right. Our next question is going to come from Mike, who's calling from American Fork. And Mike, you can go ahead. You're on the line with the congressman.
Thank you, Congressman and others. We're calling regarding the Paycheck Protection Program that the Treasury Department you folks have authorized up to about $350 billion that's going to small businesses. We're wondering if you have any insight into that, when it's coming down. We've heard rumblings in the media and others that it started, but we have applied to our SBA lender and are trying to see if we can get that. And I might say reluctantly get it because we want to keep our employees employed, but we only have about a month's worth or 2 pay periods of savings in our business account. And so I was just wondering if you had any insight into that.
Yeah, I'm going to we have Howard Headley on the line, who is the head of the Utah Bankers Association. Howard, from a timing perspective, I did hear on the news today that one of the businesses had received their check. I know that's not common right now. Can you give people a perspective of timing on if they've applied, what they can anticipate?
Absolutely. So the application is really pretty simple. It's simply just trying to identify what your average monthly payroll is, and we times it by 2.5. There's an application form to fill out, but again, it's maybe 2 pages long, and the questions are straightforward. Not a lot of analysis. We're not going to be asking for tax returns or a lot of information. Just some general information about your company name, tax ID number, stuff that really pretty simple. The application shouldn't take very long to fill out. Most folks have it available online, so I don't know who you're working with, but that should obviously, with social distancing, you're going to be doing most of this online. Then they have to go into the SBA system and enter this information, and that's probably the slowest part of this process. The system is up and down. It crashes from time to time. They processed as many loans in the first 2 days in the program last weekend that they did the whole year. And so their technology is being very taxed. So it probably I would budget for a couple of days, depending upon how many folks have applied at that particular bank or credit union. If there's a lot of people applying there, it might take a couple of days to get into the system, get all the information in, and get an SBA loan number back. Once we get that loan number, then we can put together the documents, which is just basically the contract between you and the bank, and we have to deliver that electronically, of course. You'll sign it electronically, and we get that back. At that point, we can then actually fund the loan, put the money in your account. It should cover your payroll costs for 8 weeks, plus your rent payments, your utilities. To the extent you use it for payroll, rent, and utilities, they'll forgive those costs back against the loan. So if you borrow $100,000 and you spend $100,000 on payroll, rent, and utilities, it'll all be forgiven. And then 8 to 10 weeks later, after we do that work, that's over. You don't have any obligation. If you borrow $100,000 and end up owing $80,000 in payroll, rent, and utilities, you'd have a $20,000 loan that would a residual loan. It would be charged interest at 1% over a 2-year period, but you wouldn't have any payments on that loan for 6 months. So even if you end up using the money for things other than payroll, rent, and utilities, you end up with a loan that's really pretty easy to pay off over the next 2 years. So the total time from application to getting your money, I would probably count on 3 to 5 days.
Great. Thank you, Mike, for that question. Doctor, while we're waiting for the next question, and that's teeing up, I've got a question for you. We've heard different things about the seasonality of COVID-19, and people have speculated that the warmer weather, it might act like the flu and be harder to transmit. Do we have any data on that? And do you have any ability to tell us if the warmer weather will bring some relief?
Yeah, we don't have any data on that. I mean, I think we should keep in mind that influenza, yes, is seasonal here in the Northern Hemisphere and also in the Southern Hemisphere. But influenza is constant in the more tropical regions in the world. And so just because it's warming up doesn't mean that, viral infections are going to go away. We've also seen SARS and MERS, these are other coronavirus, flourish just fine in warmer weather. This is a novel virus. We're not certain how it's going to act in warmer weather. My suspicion is that the warmer weather is not going to have anything to do with the control of the virus, and it's all going to be how we act as a community in terms of our social distancing. And then further, as we get into this, what does an effective vaccine or therapeutic look like?
Good. All right. Thank you. Adriel, let's go to the next question.
Yeah. So there was a question that was queued up that we lost the caller, but I think it's really important in light of what the governor asked everyone to do today in terms of wearing masks when we all go into public. The question was, why is it that medical masks are so hard to obtain? And what are we doing about that?
Well, if we throw this one at the doctor, I don't know if that's a fair question. Let me just tell you from my perspective, and then any of our guests on the line, please feel comfortable to jump in. I think it's fair to say that we were not prepared as a country from a supply standpoint for something of this magnitude. And then add to that that much of our supply chain for a lot of what we call the PPE came and has come from China. And so not only is that difficult, but China and other places in the world are also putting large demands on this equipment. And so we're moving, I think, in a pretty impressive way, given the fact that we were not prepared for this into local manufacturing, and people are changing their manufacturing facilities over to be able to make this equipment. I've heard of one company who's actually putting online equipment that will actually sterilize and make these face masks reusable. But at the point, I think the supply simply does not meet the demand and the demand that was not anticipated. And Dr. O'Brien, from your perspective, would you add anything to that, or do you think I'm seeing it wrong?
No, I think you're seeing it absolutely correct. And I think we also have to recognize there are many different types of masks that people are using. The masks that we see in the hospital, in particular the N95 masks, these are the masks that protect against aerosolization of the virus. These are what we use in critically ill patients and patients undergoing procedures, surgeries, things like that. They're really challenging masks to make. These are not simple masks. And so I think you're absolutely right in terms of we weren't prepared from the supply chain. And now we have the entire world trying to get these masks. The masks that the governor has come out and asking the people to wear, and also the recommendations from the CDC, are cloth masks. These are masks that you can make at home. We really want to emphasize that surgical masks and N95 masks, we need those masks in the hospital. We need those masks in our clinic to protect our caregivers. And those masks, we need to focus there. And right now, our supply of masks within Intermountain Healthcare is adequate. It's completely adequate, and we have enough supply. That's clearly something we're monitoring as we go forward and really keenly watching the epidemiology of this infection and really trying to mitigate a surge, because if we can mitigate and slow that surge, then we'll continue to have the appropriate PPE in our hospitals to protect our caregivers and our patients. The masks we talk about in the community, these are cloth masks, and these really prevent transmission of virus from the person wearing the mask into the environment. They don't protect the person wearing the mask themselves, but it protects from virus going into the community and further contaminating the community. And I do think that is a good idea for us to be wearing those, but making sure that the hospital-based masks stay in the hospital and the clinics.
Yes, and as a result, these masks that you're referring to, the public would wear, it seems like the bar is rather low. You can make them at home from a variety of materials in sizes and shapes, and they don't have to be near the standard that you're referring to with the N95s. The main thing is that they would contain a sneeze or a cough and keep that from going on other people that you might come in contact with.
That's absolutely right, yes.
Good. Okay, good. Thanks, Adriel. Our next caller, please.
Yeah. Before we take the next question, I'd just like to remind everyone that if you'd like to ask a question, you can press *3 on your telephone keypad at any time, and you'll be transferred to someone on our staff who will take your question and put you in line to talk to Congressman Curtis. If you'd like to sign up for the Congressman's newsletter, you can do that at any time by just pressing *6 on your keypad. So with that reminder, we'll just go to the next caller, and this is Tracy, who's calling from Mapleton. And Tracy, you are on the line with Congressman Curtis. Go ahead.
Hey, Tracy.
Hi, Congressman Curtis. Thank you so much for all you're doing in Washington. I'm an executive of a vitamin manufacturer that produces essential products for customers, and we have about 500 employees in Utah and about 1,000 globally. I'm calling to ask the question about testing. We have a number of employees, a few that potentially come in contact with people that may have COVID, and we're watching that. We've got a few of them on self-quarantine, but my question is, when will there be more availability for testing? Because what they're being told right now is basically if they come in contact with someone, continue to watch and see if you come up with symptoms. We're testing their temperature. We're also telling them to self-quarantine for 14 days, but we're concerned because we want to make sure that they can get tested. So when will more testing equipment be available so that we can make sure that our employees are safe and also our customers are safe using our products?
Thank you, Tracy. And I trust that your business is doing well. I know a lot of people in similar industries are doing well because of the online ability that's been developed, and I hope you're doing well. Look, if you heard our conversation about the masks, I would say we've got a very similar situation with the testing where we just simply were not prepared with the equipment to test. As a result, that's put our medical professionals in a very difficult position of not being able to test broadly, and as a result, we don't have as much data about the virus as we'd like to have. Doctor, can you give us an update on? I know we are getting better on testing, and what right now is the advice for somebody with symptoms? And I've talked to a number of people with symptoms who have made those initial phone calls and get turned down on testing. Are we to the point where everybody with symptoms can be tested? And what's the quickest way for them to make that accessible to them?
Yeah, great question. Absolutely. Anybody with symptoms, we can test. And so across the state of Utah, as of today, we have the capacity to do 5,000 tests. And looking at the Utah Department of Health data that was updated today, yesterday we only did 1,000 tests. And so we actually have quite a bit of capacity for people that have symptoms to get tested. We are not testing at our max capacity right now. So we definitely have plenty of room for people that have symptoms to get tested. You can get tested in any number of ways. There's a number of drive-through testing centers where you don't even have to call ahead. You can just show up, they'll evaluate you, they'll swab you in the car. And then we have programs then to call you when your test results are positive or negative. Those testing centers are set up from Intermountain Healthcare, the University of Utah. So we have a number of testing centers across the state. And I want to be very clear, if you have symptoms consistent with COVID, that absolutely 100% you should be tested, and we highly encourage that. The testing of asymptomatic individuals is certainly coming up nationally, and how we do that and how we use the information that we gather from that is something we're certainly evaluating. The thing we worry about is that it's not just the test kits that are in limited supply, but it's all the swabs, the reagents, everything that goes into testing. So if you have symptoms, yes, by all means, 100% get tested. We have the capacity to do it. If you're asymptomatic, those are people that we are not testing at this time.
I've heard some numbers about false negatives that are really very high. Is that true? And do we need to worry about a high false negative testing possibility?
Yeah, we definitely have seen patients that have symptoms of COVID-19 that have negative tests that then go on to develop a positive test days later after that. One of the biggest things that we are emphasizing all of our caregivers is that if you have symptoms consistent with COVID-19, fever, cough, shortness of breath, and your test is negative, is that you still self-isolate. Absolutely, we need you to stay home, self-isolate, and don't spread the virus that you have. We're learning a lot about the test, and we're learning a lot about the virus. The virus peaks early in the clinical course, and if you're presenting later in your clinical course, that virus may no longer be in your nose and not detected by our testing. So we do feel our test is very good. We know it's not perfect, but at the same time, we do have confidence in it, but we do see occasional false negatives at this point.
Good, thank you. All right,
Congressman, this is Brian. If you don't mind, jumping in real quick. There's also a website that was developed by Silicon Slopes, a nonprofit organization focused on kind of helping the market the Utah's tech industry. But they partnered with various public health departments throughout the state to develop this really robust website that can help people identify their symptoms and help connect people to various testing sites and really identify whether or not or track whether or not people should be getting tested for the virus. And that website is testutah.com, and they're going to be continually building this out and using some of the data that they're tracking or that they're collecting to figure out where additional testing sites need to be placed.
That's great. Testutah.com. I would also, I went out to that site. I don't have any symptoms. One of the things they're trying to do with that site is simply collect data. And so I think they're interested in everybody visiting that site with or without symptoms and answering a few simple questions there. And I think the more of us that go on to that utahtest.com, the more valuable the information will be for them. Thank you, Brian. Okay, Adriel.
Yep. Our next question is going to come from Kevin, who's calling from Spanish Fork. And just one moment. Go ahead, Kevin. You're on the line with the congressman now.
Great. Thank you. Hi, Congressman. Thank you very much for holding this and taking my question. We have applied. I opened up a Teriyaki Madness restaurant, and we opened right around 2 weeks before all of this hit.
Wow.
And so in applying for the CARES Act, so much of the information requested had to do with W-2 information for the previous year. And while I don't have any of that data, I'm concerned that I won't qualify because we're so new, and I really don't have any other than the application and our EIN number to submit and one payroll cycle. I really don't have any other information to provide, and I'm concerned about that.
Okay, great. We're gonna bring on Howard Headley from the Bankers Association, and Howard, are you able to help him figure out how he can access this with that limited a bit of information?
Based upon the information that we've received to date, that is going to be a challenge, unfortunately. We have to verify that you were in business as of February 15th. That's the first date that we have to look at. But then in calculating your average monthly payroll number, the shortest period that we can look at that we've been told at this point is January and February payrolls. So we can look at the payroll. It's just probably going to understate what your average monthly payroll is. But my guess is that your bank, have you already applied for it?
Yes.
You've approached a bank. It may be that they take that first payroll and they can extrapolate it into an average monthly number. Here's what we know. We know that we want to help these businesses. That's the intent of the program. And we know that everything we've received from the SBA is they've tried to be as lenient as they can be. It's just we're all trying to be careful as well with taxpayer resources that we're following the rules that are prescribed. So I'd just encourage you to work with your banker and see if they can get comfortable with the data you can provide and trying to extrapolate an average monthly payroll number and then timesing that by 2.5 and then processing your loan.
Kevin, I'd like to ask you if you would, if we've got the ability, Adriel, can you take him offline and let's give him Brian Fahey's contact information. And we're going to ask Brian to look into that just a little bit further for you. Howard's giving you a great answer, but we're going to see if we can help you any more beyond that, if we can get your number offline.
Great. Thank you.
Thanks, Kevin.
All right, great. Were you going to say something?
No, I'm hoping I gave you an assignment we can actually do offline with Kevin. I don't know exactly how our system's working, but hopefully we can help Kevin.
I'm trying to work that behind the scenes here, working on it. Okay, our next call is coming from Susan. Susan's calling from Spanish Fork. And Susan, you can go ahead. You're on the line.
Hey, Susan.
Hi, Commissioner. Thank you so much. Commissioner Congressman, thank you so much for taking my question. My question is actually about some of our commissioners and our local governments, watching kind of their attitudes evolve about COVID-19 and the impact on their local communities. I've been really impressed with the governor's approach and him gathering information from epidemiologists and his local team of economists and making those decisions with data. I have concerns about some of our local cities and them trying to make decisions without the same amount of input. Do you have any idea, or is there a system in place? I know that they can consult with their local health departments and public health officials, but they're trying to make decisions based on data. How well do these kind of rural communities and cities have access to health professionals that can help them? And do they have, in their meetings with each other, is there always a health professional present?
That's a great question. I'm going to go back and put my mayor's hat on, Susan, and kind of give you some perspective from being the mayor of Provo as well. This is a tough position for a local official. If they err on one side, let's suppose they err on the side of restricting movement, they will be blamed for hurting the economy. If they err on the other side and are not restrictive enough, they will be blamed for the virus spreading. And my guess is there is no perfect place to land. It's a very, very difficult thing. And then if you add to that the complexity, you mentioned rural, some of the parts of my district are very, very different. I talked to a commissioner yesterday, and I asked him how things were going. He said, I'm on my tractor. I'm 5 miles away from anybody. And so just the nature of their county being very different than, let's say, Salt Lake County adds layers of complexity to that as well. I don't believe that they do all have access to the best and the brightest. And if we could take Dr. Eddy and send him to every county in the state, it would be a lot different. So they're working hard to get the best information they can. I do agree with you. I think the governor's done an amazing job of navigating this near impossible situation. There has been some talk that the legislature in special session would actually take that ability away from cities and counties, and that this would be done on a state level. And that's a very difficult decision for the state legislature as well because of the difference of counties. So I just know, because I know a lot of these people, they're really trying to make the best decision they can, and there's no perfect place for them to land. And hopefully we can get them that scientific and medical advice that they'll need to make a good decision. Okay,
right.
Thank you. Yeah, let's go ahead, Adriel, with the next call.
Before we go to the next question, I would just like to remind everybody that if you'd like to sign up for Congressman Curtis's newsletter, you can do that anytime by pressing *6 on your telephone keypad, and someone from our staff will take your email address. Okay, we have time for maybe 2 more phone calls before we're done. And our next caller, this is Tyler. He's calling from Provo. And Tyler, you are on the line with Congressman Curtis. Go ahead.
Thank you so much. So my question is, what is the timeline and procedures for the average individual payments that will be receiving from the stimulus?
Yeah, great question. I think we're literally days away from those payments starting to arrive, perhaps a week away. That is for those who have given, when they pay their taxes, their banking information. The government can respond much quicker if they have that and direct wire that into the accounts. Brian, do you have any more information from Washington about timeline and what to expect on those individual payments?
Yeah, I think the Treasury Secretary today said that those payments will start. People will start to see those payments being directly deposited into their bank accounts within the next week to a week and a half. And the rest of the payments, they're still working to, depending on your situation, if you didn't file taxes in 2018 or 2019, then you can give the Treasury Department, you can submit your banking information to the Treasury Department in an online portal that they're still building at the moment, but that should be up momentarily, and that will give the IRS access to your banking information for you to receive those direct deposits. If you are a Social Security recipient and you don't have direct deposit, you'll see those checks come in the mail, and you can sign up. You can give the IRS your information via that portal that hopefully the Treasury will have completed shortly, and I'm sure we'll be putting out information on that once they finalize those details.
Good.
Congressman, can I just jump in there for a second? So there are going to be a handful of groupings. Beginning tomorrow, about 75 million Americans will begin receiving direct electronic payments into their accounts. And like you said, those are the people at some point in time have given that routing and transit number information via their tax returns over the last couple of years. There'll be 2 more of those tranches, about 15 million individual tranches that will receive direct payment ACH over the next couple weeks. If if you don't get those, or if you haven't given the Treasury your routing and transit numbers for like a direct deposit of your tax refund in the past, the quickest way to get that done is to file your taxes and to div it. So if you haven't done your taxes yet, get that done, put your routing and transit number in there, and then they'll have that, and you'll get put into one of those remaining 15 million person tranches. And then, as it was discussed, if you've already filed your taxes and you didn't give them your routing and transit number, they'll have a portal up in the next week to 10 days where you can go back in and enter that. Then they're also working on a separate portal that has nothing to do with tax filings, where you can just go and enter that. But I want to caution everyone. That's a better way to go. We want to get you that money electronically, directly deposited in your bank account, because the remaining folks, 70 to 100 million people, will get a paper check printed. And those paper checks are ripe for fraud. And so we really want to get as many people into this electronic format as possible. The other problem with the paper checks is they can only print 5 million paper checks a week at the Treasury. So if there's 100 million people getting paper checks, you can see that if they don't have your information, it could be months before you're in a group, again, 5 million a week, where you're going to get one of those paper checks. You can take that paper check into your financial institution, but for those people who don't have a bank account, again, we're worried about fraud as it relates to that. So I would do everything in my power to get that done electronically, even if it meant filing your taxes earlier than you were thinking about, and putting your routing and transit number in there.
That's great advice, Howard. Adriel, I'm hoping we still have time for one last question. Before we do, let me just mention that we do have on our website, curtis.house.gov, under COVID-19, a frequently asked questions. And we'll try to gather as many unanswered questions as there were today, and to make sure they're represented on that document. Kevin, if you're still listening and we weren't able to connect with you, you can, at that curtis.house.gov, or anybody really listening, you can send us an email, and we'll do our best to respond to every email that comes in. And that's why the team is so valuable. Okay, Adriel, we got time for a quick one?
Yeah, we'll just do one quick question, so be quick with your answer, too. This next question is going to come from Ronald, who's calling from Spring Lake. And just so everybody knows, I will be giving you the phone number for the office. In case you didn't get to ask your question this evening, you can call in and get answers from somebody on the staff. If you want to just hang on at the end, I'll give you that number. Okay, so let's now go to Ronald from Spring Lake. Go ahead, Ronald.
Well, you're solving the problems present.
Ronald, we just barely had you. We just barely started to hear you. So if you'd start again, that would be great. Thanks.
Okay, I'll try it again. While you're solving the present problems, have you got any plans for the future flu season that would approach us for the following winter months? Do you recommend shutting the economy down again, or is there a different way to approach the problem?
So thank you, Ronald. I'm going to ask the doctor from his medical perspective, and then I'll give you a quick, maybe political perspective, and then unfortunately we need to wrap up. Doctor, do you want to give us what the fall looks like from your perspective?
Yeah, certainly. We have to anticipate that this virus is going to be part of the normal respiratory viral pathogens that we see from year to year. We anticipate that we'll see this again next winter. We just have to make that assumption that is going to be part of it. The difference is going to be the fact that we most likely will have an abundance of tests. We also will have the ability determine who has developed immunity to this test. We also may have therapeutics in which we can treat this. And we also hope that our health department is not nearly as taxed as it is now. So when we do see a case, we can go ahead and do full contact tracing and really identify the extent of it. So my hunch is that, yes, it still will be present. We'll see it circulating, but I think our response in future cycles is not going to have to be as extreme as it is right now.
That's good news. And because of time, we're going to end it there. Adriel, I'll turn it back to you, but I'm going to go ahead and make my closing comments just quickly because we're so tight on time. First of all, a big thanks. Brian, thanks for joining us again. Dr. Stenyam, thank you for your expertise and being with us. And Howard, thank you as well. And to those who phoned in, thank you very much. And our staff have manned the phone lines, thank you. We will keep coming back to you with more videos, with more Tele-TownHalls. Please stay in tune with my website, curtis.house.gov, where you'll be able to see when and how you can continue to connect with us. My apologies to so many who we didn't get to answer your question, and once again refer you to the frequently asked questions page on our website, and we'll try to keep adding to that as well. Thank you all, and Adriel, thank you.
Yes, thank you, Congressman Curtis. And thanks to everyone for joining us tonight. So for those of you who did not get to ask your question to Congressman Curtis, you can call the office and speak with someone on our staff. That number is 202-225-7751. And I'll repeat that one more time. The number for Congressman Curtis's office is 202-225-7751. So thank you, everyone, for joining, and we appreciate all of your questions. Thanks for participating this evening, and thank you, Congressman Curtis.
All right. Thanks, you all.